we are in a joint. There are three kinds of joints: synarthrosis, that's the immovable joint, amphiarthrosis, slightly movable, and diarthrosis. We're going to spend most of the time talk about the diarthrosis. So first one, synarthrosis, immovable joint. The suture is one of them. We talk about the suture in the bone part, but suture is between bone and bone, so by definition it's a joint as well, so it's completely immovable joint. And in the joint, if you choose flexibility, and you lose stability, and if you choose stability, you lose flexibility. You cannot have both of them. And the suture is a very good example of choosing stability. It's completely immovable and it's very, very stable. And when we talk about the completely movable joint, like the shoulder joint, it chooses flexibility, but it turned out you see people's shoulder pop out all the time, and because it's a very unstable joint. The gomphosis, the peg in socket joint, like your teeth, that's another example. The synchondrosis, you use the hiding cartilage to in a joint, like your epiphyseal plate and rib 1 and sternum is immovable. Amphiarthrosis, that's slightly movable one. Example, between your tibia and fibula, you put the ligaments and they can move a little bit, so slightly movable. Symphysis, that's another example, like your pubic symphysis between your two pelvic bone, and you put the cartilage there, and also between your intervertebral disc, and these are slightly movable. Okay, we spend most of the time going to talk about the diarthrosis. That's the free movable joint. And let's look at the joint structure. It's called the synovial joint. They use the synovial membrane to cover it, and inside you put synovial fluid, and then you put the joint capsule, like the duct tape, cover the outside. And other structures, they may have meniscus, menisci, plural, bursa, sometimes they have the fat or ligaments. So let's look at the joint. Synovial joint, that's a synovial joint. And you have bone and bone, you have the cartilage. Ideally, you don't want to have a cartilage rub against another cartilage. You want to separate them. So you put synovial fluid. And synovial fluid were produced by the synovial membrane. So this green one is synovial membrane. They produce synovial fluid. And outside you put those capsules, those big duct tape, cover it. And that's a very typical synovial joint. And if you like to crack your knuckle, you may heard crack your knuckle lead to arthritis, and it's false. It's false. So why you can crack your knuckle? Because let's go back to the synovial joint. So inside the synovial joint, you have fluid and you have air dissolving in it. And when you crack your knuckle, you increase the distance. So when you increase the distance, the pressure decreases and the air bubble form and they break, and that's when you hear the noise. So after you crack the knuckle and this big bubble becomes small bubble, so it will take a while. You can crack the knuckle again after you do it. So crack your knuckle won't lead to arthritis. Okay, let's look at the other structure. Fibrous capsule, the outside, that's I call it the duct tape. So that's the dense irregular connective tissue that's stronger. And inside you have the synovial membrane, and that's the green one. So they produce synovial fluid. That's the loose connective tissue. And this synovial fluid is liquid, and it's mainly water with some glycoprotein, so its function is lubricate. Because of this structure, the joint can last forever if you take good care of it. But if you don't take good care of it, it turns out you can have a cartilage rub against another cartilage. And cartilage is avascular, is non-innervated, so you don't feel it. until you run out all the cartilage. You can have a bone rub against another bone, and it hurt a lot. And sometimes the situation is too late, so you may need to have a new joint, new knee joint, or the other joint. You have to replace the whole joint. And this the video lead to the knee surgery. If you are interested, you can watch it. Now let's look at the joint movement. The joint have different kind of movement. We're talking about synovial joint, the free flexible one. So flexion, extension, and hyperextension. This is one. AB duct, AD duct, it comes with one pair, and circumduction, rotation. So let's look at them. The first one, flexion, extension. So the definition is between bone and bone, there's a joint. So when you decrease the angle, that's flexion. So you can flex your elbow to show your biceps bronchi. That's flexion. So decrease the angle. When you move back, extension. So you can flex your wrist, extend your wrist. You can flex your head, extend your head. When you go over a little bit, go over 180, this is called a hyperextension. For some joints, you can do the hyperextension, like your head, your wrist. In your elbow, you won't be able to hyperextend. You can break it. So it depends on the joint. AB duct, AD duct. So this time, this joint starts from 0 degree. So your arm, and is 0 degree, and you start to increase the angle. That's called the AB duct. So definition is increase the angle also away from the center line. That's AB duct. And when you move it back, it's called the AD duct. You found I called AB duct, AD duct. The reason is these two words sounds very familiar. So I called AB duct and AD duct, so you know there's no confusion. You know I'm talking about AB duct means move away from the center line, and AD duct you can move back. So you can AB duct your leg, AD duct your leg, and you can do it on your wrist. So you can AB duct your finger, AD duct your finger. And you can also flex, extend your finger. So your finger have a lot of flexibility, similar for your wrist. Next one, angular movement, circumduction. And we have the rotation, we have the medial rotation, lateral rotation. Let's take a break.